COVID has acted as a really interesting catalyst in, I think, highlighting for the average person the underlying sort of substrate of healthcare is not unified.
Healthcare is definitely is a great space to invest with the caution that it is a long-term investment cycle.
Sequencing can play a big role in surveillance and really tracking the disease progression as it spread across and really trying to understand more about the virus.
The cloud is great. It solves a lot of real-world problems, but it's not just one cloud anymore. Public clouds, private clouds, edge clouds. The average business uses 5 different cloud providers. It's become chaotic and complex, with unpredictable costs, inconsistent security, multiple management tools, and different formats for workloads that span cloud platforms and providers. But it doesn't have to be that way. The Dell Technologies Cloud, powered by VMware, can be the one constant across your clouds. It brings consistent infrastructure and operations to your multi-cloud environment, so you can choose the right cloud for each application. A public cloud that lets you easily tap into services. A private cloud that's fully under your control. Or the edge with cloud as a service. With a true hybrid cloud experience, your business becomes more agile with simple workload migration and easy onboarding for new assets. Your teams get to market faster. With simplified operations and automated processes, you reduce risk and strengthen your security profile. And with Dell Technologies Cloud, you have flexible consumption options, reducing your total cost of ownership. Like it or not, the business world often requires many clouds. Now, that's easier than ever, with consistent infrastructure, operations, and services across all your clouds. You get the cloud without the chaos. The Dell Technologies Cloud.
So investment in the healthcare sector is very diverse, with VCs investing in their specific area of interest, right? Digital health, diagnostics, devices, biotech, pharma, genomics, healthcare across the spectrum from payers to providers to patients. Today, we have the opportunity to talk and hear from 6 healthcare investors, each which focuses on a different investment thesis. We have Alex, who is a partner at Khosla Ventures. Amanda is the Global Health for Illumina Accelerator. Anya is the co-founder of Healthy Ventures. Bill is a CEO and Managing Director at Rock Health. Mohit is a Senior Advisor at General Atlantic, and Vab is a founding partner at NTT VC. Please join me in welcoming these 6 amazing venture capitalists in the healthcare, biotech, pharma, etc. space.
What does science look like? Is it only in a lab where men in white coats peer into microscopes? No. Science is here, in this moment, in every question and every small step forward. It's here, in our own backyards. It never stops. It's never done. But every once in a while, it changes everything.
But to start off the session, I would like to ask each one of our panelists to briefly introduce themselves, educate us about their investment thesis, highlight a few of their portfolio companies, and share investment areas that they're super excited about. Following that, we will go into a moderated Q&A sessions. And since we want this to be an inclusive opportunity, we want you, audience, to engage and question, give us the questions. And you have a Q&A box at the bottom of the screen. Please include your name and the name of the speaker that you're addressing the question to. So we look forward to hearing from you, but I'd like to get started with our panelists. So Alex, do you want to begin?
Sure, thank you so much for inviting me. I'll try to be quick and make it under 2-3 minutes. When you invite an investor to talk about their portfolio, you're in for potentially a long conversation, because I think many investors are proud of all the investments they're made. But we invest broadly in technology with a vision that technology can improve the human condition and hopefully build a big business along the way. Companies that I might highlight are Impossible Foods, which we did as a clean tech investment; Square, which we did as an investment enabling small retailers to avoid predatory banking fees; Guardant, which we invested into as a approach to reinventing how we do cancer diagnosis; and other great companies like that. Rocket Lab, which just returned to launching rockets successfully this past weekend. I focus primarily on our healthcare portfolio, which for our life science portfolio, which for us is everything from radiology, AI, through to deployed healthcare businesses, diagnostics development. We're doing a lot of work in COVID diagnostics, for example, and a lot in therapeutics discovery. So thanks so much for including me.
Thanks, Alex. Amanda, do you want to go next?
Hi, thanks Dipti for having us, and thanks for the discussion today. I'm Amanda Cashin. I head up Illumina Accelerator. So Illumina Accelerator is a company creation engine focused on building genomics-driven startups. So over the past 6 years since we started, we've now helped to launch 45 different companies from across the globe. We have 2 sites now, one in San Francisco Bay Area and one in Cambridge, UK. So some examples of companies that we work with are therapeutics companies like Encoded Therapeutics or Mantra, who are sort of driving a new era of genomics-driven drug discovery. We also have a number of diagnostics companies, including Convergent, who's a liquid biopsy company, or NextGen Jane, who's a women's health company. We have some synthetic biology companies, one that's not healthcare, but super cool. It's CheckerSpot. They're working on material science, and their first product they launched was for backcountry skis. So kind of different to hear a genomics-powered ski company. And then we have some also tools companies. So likewise, like Alex, we do have a couple companies that are working on COVID testing or COVID instruments. And we do have a couple of investments, recent investments that we've made in India. So that might be interesting for the discussion as well.
We can get back to that a little later. Bill, do you want to go next?
Absolutely. Thank you, Dipti. So I'm Bill Evans. I lead Rock Health. And, Rock Health has been around for a number of years. We've been investing our funds since 2011. And there are a number of areas that we're invested in. Our mission broadly is to make healthcare massively better for every human being. And we do that by investing in software-driven business models that have the strong likelihood, the strong potential to transform the way healthcare is delivered. So that spans quite a bit. We're in digital therapeutics companies like Omada, Virta Health, both of those are in diabetes. Vivante Health, which is, think of it as Omada, but for gastrointestinal. We're investors in remote monitoring and very excited about the potential there. Companies like Podometrics, Bodyport. We recently put a big focus around what's broadly called femtech, and we've published a fair bit about our views on this space, but we're in maternal health and well-being with a really exciting company called ULA. We're investors in workflow as well in the back office of healthcare, companies like Collective Health that are scaling well there. We cross over to some of the biotech investors that are on this panel, where we've invested in companies like Benchling, which is a tool for lab scientists to do their work more effectively. And I think areas that we're looking towards now are how to be really impactful around the aging population as one example, that something that we're really excited about and still looking into.
Thanks, Bill. Mohit, you want to go next? You're on mute, Mohit.
Can you hear me now?
Yes.
Sorry about that. Good morning, pleasure to be here. So Mo Kaushal, physician by training, spent the last 15 years investing in essentially all stages of healthcare. I do venture capital deals individually now, which tend to be more focused on just pure technology applied to healthcare. In addition, I'm a senior advisor at General Atlantic, who are a global growth private equity firm, so I tend to focus more on later stage technology-enabled services. I'm mostly hypothesis driven, and I play different themes based on capital requirements. So the earlier stage, as I said, less services, more technology, and then the later stage, more of a service component, which I do think is important in many parts of healthcare. And then just in terms of themes I like, look, I think there's a bunch of different drivers for change in our business, and technology being one, but also policy inflection. So I spend a lot of time in that space. In terms of specific companies, Oak Street Health is one of the first deals I did with General Atlantic. It's a primary care business with physical locations, but a lot of technology empowering that. We just had a phenomenal IPO there a couple of weeks ago. On the earlier stage, I'm an investor, board member of a company called RxAnti, which is analytics, but we're now also building a service model, pharmacy at home care model there. So it gives you an example of sort of service enabling a tech company. Yeah, excited to be here and happy to go deeper into any of these themes.
Thanks. Thanks, Mohit. And we have Vab from NTT Ventures.
Hi, Dipti. Thank you for giving me an opportunity to be part of the panel today. I'm a founding partner of a new VC firm. It's called NTT VC, which has been created in the partnership with NTT Group. It's a $500 million fund, independently run, but we have access to NTT customers and partners. People may not know that in NTT in the US is one of the largest SI for a lot of providers and insurers. So we offer our portfolio access to those clients for potential partnerships. NTT VC is an early stage investor with focus on technology enabled businesses. I have a personal interest to learn healthcare for many reasons. So we have made 3 investments in the health tech space. One is Friends. They have a strong partnership with Mayo Clinic where they're applying AI and machine learning to analyze the patient's record and then help pharmaceutical companies answer the questions they're looking for. Second one is Echo Health. Is a electronic AI-enabled stethoscope. 50,000 plus frontline health physicians, nurses, healthcare professionals are using that product now. And the third company is a sensors which go under the leg of your bed and without touching the patients or people, it can give you biometric data all the way from the heart rate to your breathing and which way you're sleeping and many other things. So what we are looking for is combining of a computer science and healthcare and easy to understand value proposition for end users and the buyers.
Thanks, Vab. Thanks, everyone. This is an amazing group of investors we have in our midst today, and they've set the stage dialogue we will have today. So please do send us your questions. And as we begin with some of our own that we have.
How can you make a positive contribution to society while also getting returns on your investment? One place to look is in developing countries and emerging markets where millions of people need better ways to address healthcare needs. Every year, countless people face catastrophic health expenses that lead to financial ruin, impacting them as individuals and families, but also society at large. One approach to address this need is creating a pay-as-you-go health wallet that individuals, particularly the poor, can use to finance or save for medical expenses and health insurance. If someone can automatically set aside a small amount of money on a regular basis, they will be prepared when a need arises and avoid a potentially catastrophic setback. The good news is the technology already exists to do this. And because the vast majority of people in the developing world have mobile phones, the time is right to create new and better tools to support their needs. In sub-Saharan Africa, mobile money accounts went from 200,000 in 2006 to over 277 million in 2016. One effort in Kenya has shown the health wallet model works. Mtiba users have demonstrated that it's possible to save, send, receive and pay for medical care all by mobile phone. We believe combining catalytic funding and first loss capital with private equity can get the job done and effect significant positive change.
So I just wanted to start off with this year, 2020, right? It's been a roller coaster ride. Venture funding in healthcare has soared to 10.4 billion in just the first half of 2020. And it's nearly matching 2019's full record coronavirus outbreak is exposing inefficiencies and inequalities in our healthcare system. There's a lot of room for improvement, and innovators are jumping in, and the investors have all the money. So question I have for you, what is your take on this? And we'll go to each one because I know each one of you will have a different opinion on this. And is this a good time to invest in healthcare? If so, where would you put your money? Vab, you want to go first?
Okay, thank you. Healthcare is definitely is a great space to invest, with the caution that it is a long-term investment cycle, because in healthcare things don't happen very rapidly, even though there are a lot of news of FDA moving fast on certain tests and all this stuff. But overall, it takes time, and there are many companies, so they have to always differentiate: is it a feature or really a company? But I think one thing COVID is helping is bringing a lot of scientists in different healthcare systems who are even competitive to work together. So hopefully that will drive a better solution, better care, better economics for the whole ecosystem. So yes, it's a great time to invest, but at the same time, I think companies need to make sure they are cash efficient, because it may take years to build large companies in this space. So.
Mohit, what is your take on it?
Well, look, at a macro level, COVID has perpetuated winners and losers in multiple industries, right? Apple's got a greater market cap than all the FTSE in the UK. And then within healthcare, it's the same. So the losers being sort of dental service companies, right? They can't see patients, they've got decreased volumes. In terms of winners, anything telemedicine related, obviously, which has been empowered by COVID. And then just look, I think biomedicine in general is just going to have huge budgets. Given I don't think anyone wants to live through another COVID. So budgets for diagnostics, budgets for supply chain, budgets for rapid sort of discovery and bringing drugs to market. So I think that whole space, which is complicated, is super interesting. And again, the point being, healthcare is multiple different verticals. So I just don't think I can give a generic answer to every piece of it.
That's true. Healthcare is so diverse, and each piece has its own vertical, right? So, Anya, do you want to give this a go?
Yeah, so Anya Shees, Healthy Ventures. We're an early stage fund. So I agree with everything that's been said. You know, first of all, healthcare is not a short-term industry from an investment perspective, as Vab said. You have to have a very different mindset, whether it's biotechnology or whether it's healthcare technology, than you might in, for example, consumer tech. The inflection points just take a longer time going out. But I think COVID has, as Mo said, COVID has acted as a really interesting catalyst in, I think, highlighting for the average person the underlying sort of substrate of healthcare is not unified, right? And so the opportunities for tech in doing that are pretty significant.
That's good. Yeah, and Amanda, I know you, Illumina was one of the first companies that sequenced the whole COVID genome. And how do you see this COVID-19 and genomics panning out?
Okay, so that's a different question, but yeah, happy to try to tackle some of that. I mean, I think it is really interesting in terms of what sequencing around the globe has helped kind of uncover as we're trying to sort of tackle COVID in real time. You know, the first whole genome of the virus was sequenced and published in early January. And then I think that mobilized a lot of folks, whether it was folks in the diagnostic space to develop sort of targeted sort of tests of PCR-based tests for COVID, or whether it was mobilizing folks like Moderna trying to develop a new therapeutic or a vaccine for COVID. So it's pretty cool. I think, you know, sequencing can play a big role in surveillance and really tracking the disease progression as it spread across, and really trying to understand more about the virus. So that's been really interesting to see. And I think there's been a lot of really cool work in Washington, and UCSF, and other places that are really tracking the outbreak from a surveillance perspective. And then certainly from sort of a sequencing perspective, Illumina did launch a COVID-seq that got EUA approved for rapid sort of high throughput testing for COVID. So it's a lot of things, and we're, I think, enabling some of that through our technology, but there's a lot of folks across the globe that are trying to do some really, really important things, I think, to get answers, to get solutions to all of this. So maybe that's all I'll say there. But in terms of investing, I don't know that I have a ton more to add to what others have said around the group here, but I do think it's an amazing time to be investing in healthcare, whether you're a family office thinking about diving in, or whether you're a VC, or whether you're an entrepreneur thinking about creating a company in healthcare or in life science. I think it's a great time. We know so much about, we're learning more and more about disease biology. There's still more to learn, but we have these enabling technologies like next-gen sequencing or AI that are really helping make some of this knowledge accessible that was previously inaccessible. So it's a really cool time as we're learning more about biology, as we're finding new technologies, new solutions. So people are being very innovative, and I think it's a cool time to be. The intersection between life science and data science is converging in really powerful ways. I think that adds challenges, but the multidisciplinary aspects of things, I think, is always when really true innovation kind of happens. So I think it's a really great time to be in this space. And it's really cool to see the conversation from a sort of a COVID perspective. Everybody's talking about science and reading primary literature now as for sources of information about what's going on. And that's new. I don't know that people are always looking at nature and science the way that they are now, trying to find out what's going on in science. So it's really cool.
That's true. There's a lot of behavior change and a lot of interest in science and figuring out what's happening next for COVID. Alex, do you have a point of view that is differing, or you add something to what the others have said?
Well, maybe I'll add something. I think Amanda talking about the genomics and sequencing and surveillance has highlighted the real power of contemporary sequencing to elicit and data science. An example would be techniques that were pioneered in tracking transmission of HIV through sequence data are being applied here to see if there's more transmission happening in a population that you're not seeing, because you can model the mutational rate of the virus in a population. And if you're seeing more mutation than the sampling that you're getting would suggest you're not matching you're not modeling the appropriate rate of burden in the population, sorry, maybe I'm not explaining it clearly, but it's basically an information theory type of question. Is there more activity there happening than your sampling of the population would suggest? And you can get that from sequencing data, because there's basically latent information in the amount of variation of the virus. And that's just an example of, people might say, well, we just need to do some level of testing to just detect, for example, virus protein. And see if people are shedding a significant amount of virus. I think there are many more powerful things that you can get from sequencing, and that's just one example of the power of omics. I think many of the things maybe in the previous session we talked about biotech bleed over and what will be interesting, and COVID has provided an amazing test bed and driver of technology adoption, technology that was already here but didn't necessarily have the tailwind. He talked about certainly telemedicine, but point of care diagnostics. So for a while, major payers in the US were not reimbursing for viral subtype testing for which actual virus you had for an upper respiratory infection. I think that will be very hard to roll back now as we try to differentiate sources of infection. So I think a lot of stuff is being opened up secondary to COVID. And hopefully that'll be the long-term benefit to society in general for other kinds of infectious disease transmission, but just in general, surveillance, population surveillance, and diagnostics.
So I think just to build a little bit on what Alex said, I think it's useful to separate a couple things. One is the policy changes that are happening, right? That I think are very unlikely to be rolled back, whether that's codes in terms of, billing that's allowed on subtype testing, whether that's reimbursement for telemedicine, in a similar vein to in-person, all of those types of things that I think are behavior change, but policy change that's pretty durable. I do think we have a tendency as people to overstate the behavior change of individual behavior change that will persist, right? Decades and decades and decades of research shows that people are lazy, and absent a very compelling reason, for example, to wash your hands 20 times a day for, 20 seconds each time or whatever. People don't do that. So I think we need to draw a distinction between really important things that we should all be creating companies around or investing against, because they really are inflection points that are really changing how healthcare is delivered, and consumer behavior, which I think is actually more inertial than a lot of people are talking about these days.
I'll jump in there as well. Anya raises a great point. And one of the things that Rock Health does, Mohit mentioned being very thesis driven. I think we do a lot of market research in order to be really thesis driven. One of the things we do and have done for 6 years running now is survey consumers on their behavior as it relates to the adoption of many of these tools. Now, I'll just give a hint because we haven't yet crunched all the numbers on the 2020 data, but what we've seen is a real steady adoption. So kind of back to this original question, and this year where we're seeing a large uptick in funding when it was not anticipated. Frankly, I went on record in our end of year and our Q1 funding synthesis saying we thought this would be a down year. So we were wrong. I was wrong. But what's interesting is that, you know, there's going to be an uptick in telemedicine this year, but the year over year, 6-year trend has been steadily up. And I think what's really keenly important and what we should look for in the next round of data that we publish is, are we seeing new subgroups enter the market? Subgroups that have been less amenable, less ready to adopt. And I think what we've been looking for a number of years is that switch, because early adopters adopt early, tautological, that's how it's defined. And then late adoption, does it plateau? Or do we break through with new groups? And my strong suspicion is we're going to see difficult to reach, more vulnerable groups are going to adopt. And then in 2021, we'll see if they snap back or not. But the money is definitely trending towards the belief, at least venture money, in a very strong way, that there is not going to be a large pullback from a regulatory point of view or a consumer point of view. And that's just empiric right now. There's a lot of money that's flowed into the subsector for telehealth and remote monitoring.
Thank you. Yeah, you know, you're right. I mean, that's great news for all the technology entrepreneurs that we have in our audience. That healthcare, there's going to be a lot of innovation and there's a need for it. Behavior change may not be rapid in consumers, but it's happening. And at its core, medicine is all about gathering data, deciphering and sharing information, right? We've been doing this for thousands of years from when we were humans as hunters and gatherers, and medicine has been practiced, but it's changed and evolved, right? Today, information flows between patients and doctors and doctors and doctors and doctors and pharmacists and clinicians and so on. But it's really very, very, very choppy. Technology plays very little role, and that increasing role of technology we are seeing. But we still don't have complete continuous vision, right? We just have snapshots with gaping holes in them. We're not capturing that full spectrum that we could possibly with the use of technology. So where do you as investors see breakthroughs need to happen so that we can have this continuous interaction and bring healthcare into the 21st century? Alex?
Well, I can jump into
Amanda, whoever.
Okay, I'll just jump in. And it was sort of following up on a point that Alex was making earlier around infectious diseases. So I'm not sure if it's a technology gap really, but I think it is a gap of focus, and it is sort of looking at infectious diseases. And I think COVID's brought that to light. I think the next big challenge that we all know is coming, but that has been underfunded, is antibiotic resistance. And these super bugs that are emerging that we all know are coming, and that people just really don't know how to find the economic incentives to tackle. And that's, you know, I think hopefully, I don't know if it is, but it needs to really wake people up and to start investing in this space. And we at Lumen Accelerator, we invested in one company recently in India that is working on, I think, a huge challenge. They're working on infectious diseases. They're working on, you know, specific populations in India, and then they're working on tuberculosis. So there's a lot of things that are hard with that. But it's a huge unmet need, and that we really kind of have to find ways to tackle. And so they're doing that. Erogi AI is the company. I think there's a lot more attention that's needed to kind of really combat infectious diseases and the antibiotic resistance, whether it's developing novel therapeutics. And we have, you know, some companies that are working on that, including Felix, and others, and we have some other diagnostics companies that are working on, determining which drug to use for infections like UTIs, including one company, BioAmp, that's working on that to reduce the overuse of antibiotics. And so there's a lot of things that I think the world needs to kind of start focusing on. It's not necessarily a technology gap, it's more of a focus gap.
So if I can respond, one of the things I'd like to plug is that Bill Evans at Rock Health has a wonderful newsletter. So if anyone in the audience is interested in digital health entrepreneurship, I really suggest you go and subscribe, and it has wonderful content. So he sort of alluded to some of the reports that they produced. And so I'd really encourage anyone to go out and get them. Something that Amanda said, I think is worth, so we're investors in a little bit of things around microbial resistance. We have a company in France called Eligo, which is doing CRISPR delivered through phages, and some other projects. I would note that I'm a little bit more optimistic in that many of the high throughput screening technologies that have been developed over the past few decades, I think are highly amenable to screening for compounds or phage, et cetera, that are active against resistant organisms. And so I think if the need arises, I think there are tools in place to relatively quickly start to make progress there. It's at an unprecedented rate of development. I think there are a lot of tools just poised in the wings. So although we don't have a huge formulary for drugs for antibiotic resistance, the problem is they wouldn't be used right now because the concern would be that they'd be resistant to those drugs. But I think there are tools that are in the wings that are ready to deploy. So I'm a little bit more optimistic, I think, than some people are. I think the last point I would say, that you asked about where innovation is coming from. And one of the things that I think might be interesting to this audience is I have a pretty strong feeling that India is the place to look for innovation in healthcare delivery, because it is a very large country with a highly fragmented healthcare system, with many different stakeholders providing healthcare in lots of ways. Many companies are trying to do mobile first based EHR systems. They're trying to do a consolidation. We see that with Devi Shetty's work. There's one model, the efficiencies that you can do in India. The Apollo clinics share one model. I think there's an amazing opportunity, and it's sort of like a whole laboratory of different approaches to healthcare delivery models, upskilling providers, using technology. The government's interested in pushing a medical record for all system. I think that's the place that I would look for the maximum number of natural experiments where we may observe something that really works in a model that really works successfully. Now, there are some differences, of course, culturally and population, et cetera, from other parts of the world. But I think there's a hotbed of innovation, unlike anywhere else in the world right now in healthcare delivery.
Yeah, I totally agree. And to add something to what's both been said, on the healthcare delivery side, right? So we've talked about sort of biotech innovation and what's really interesting there. On the healthcare delivery side, I think it's two things. Number one, so many of our diseases these days are behaviorally mediated, right? I mean, COVID obviously is top of mind, but infectious disease is not something that is, killing the vast majority of at least the developed world these days, and increasingly the developing world. But what the right treatment is for different people is different, right? So, me versus Alex versus Vab, Mo, we all kind of might be of similar backgrounds, but what is going to motivate me to do something might be literally a doctor just saying, hey, Anya, do it, right? And I'm a rule follower and I'm going to do that, and that's great. But for other people, it's different. And we right now don't have what I call the motivation graph, whatever, it's a dumb name, but a way of sort of saying, okay, I understand what type of person you are. And when I want you to do X behavior, I know what's going to motivate you versus you versus you. And being able to uncover what that motivation graph is and apply it to different technologies, digital or in person, digital or analog, is going to unlock a tremendous amount of value. The other thing on the drug side is we are terrific at, and we are getting, better and quicker and everything at developing new drugs and really sophisticated therapies and everything else. But the underlying distribution is problematic, right? So think about immunotherapy. Immunotherapy is great, but has so far, same thing with gene therapy, so far under delivered against its promise, in large part because of all of the just logistics about, getting this to people and all the rest. So I think, the US, not to get political, but the COVID experience in the US is, I think, the perfect example of that, where, we have just failed so miserably on the basic public health stuff, yet our vaccines and therapeutics and everything are, great. But okay, we get a vaccine. Will we be able to deliver it to our, people in the form? So I think if we're really thinking about not just cool innovation, but how that innovation gets to people such that you can get paid for it and all the rest, we really need to think about that unsexy delivery layer and what that looks like.
True. Mohit, Vab, you want to add?
Yeah, I had one point. Look, I'm always super excited by great innovation. I think the elephant in the room, especially now where GDP debt ratios are close to 110%, is look, how can we really pay for premium pricing for a lot of this stuff? And that's why I'm so excited about some of the things that Alex and others have said around data science applied to drug discovery. I think discovering stuff faster, better, cheaper, and bringing it to market in fundamentally new organizations which don't have the cost structures that traditional biopharma have, I just think it's a super fascinating space, and not only good for the patients, but also good for the macroeconomic climate.
Yeah, true. So shifting gears, I know India came up a lot, and a large number of our audiences from India, where it's really late right now. So shifting gears, there's a lot of interesting innovation that's coming out of India. I think Alex alluded to it, and I know both Amanda and also Bill have companies that are looking at India as a market. So you have companies that have founders that are of Indian origin, and I just wanted to see what your experiences were. What do you see as strengths as investing in this market in India, and what are the challenges that you see? And what advice would you give to startups that are looking at India as a market?
I'll lead off very briefly here. Alex said a bunch of things very well just a minute ago about why India is so exciting and interesting as a set of natural experiments that can take place from an investment and a portfolio theory view, perhaps. Those are also challenges for outsiders, of which I count myself as one. And so I think to your question, Dipti, it really does take a team that has great deal of on the ground depth and expertise, as well as a network, not just in the investment community, but primarily in the healthcare communities of interest that the business seeks to serve. So, delivering health wellness clinic models versus in-person, in-home care. These are all very different in the U.S. and culturally, it's quite exciting that there are opportunities to just go with completely different models that are out of pocket and in-home and things that you wouldn't really think are possible in the U.S. But nonetheless, if and when, and I believe when some of these things really take off in the Indian market, I do strongly believe will be battle hardened and proven in ways that can be taken back outside of India and elsewhere.
The one point I will make about India, just because it's a large population for everything, either any technology or consumer goods, India always has been a large market. But India does have some very unique differentiators, right? The income per family, right? If you take the few percent on the top, it's still very low. So the models and offerings has to be cost effective, right? We really also need to move, CT scans, MRIs, much more closer to the villages and closer. So, and then you have to keep government also in mind, because a lot of people depend on the government subsidies and the healthcare provided by the government hospitals. But I think opportunities are there. You need definitely a local team, and you definitely need local VCs. So traveling from US and just making investment is not enough. So I think strong syndicates I think are the key, and the opportunities are large.
So it looks like we have a number of questions from our audience. There's a question to Bill referring to your survey results. Is senior population greater than 60 years also showing willingness to adopt technology like telehealth?
Yeah, boy, be careful if you ask me about data. I'll dominate the panel here, but I'll be very narrow in my answer. The subgroup analysis is where this gets interesting. So within the aging population right now, generally adoption is lower for most telehealth tools. There are different things that we look at. Some of them are just pure telemedical consults. Others are things like, do you go online to get information? That's very widely adopted across all age groups at this point. Within that subgroup, and when we talk about telemedicine, what I would say that's interesting, because lower adoption you'd expect, but what's really interesting is that when recommended by a physician, that older age group tends to adopt it much higher than average rates, meaning the average across age groups. So there are really some interesting behavioral things you can start to drill into around what does it take to get a lower adopting group to shift in to a higher adopting group. And some of them are very small tactics like this that we've seen in our data and then pulled through into our portfolio that can be really quite effective.
Yeah, and there's, of course, there's another question here on behavioral health and health records consolidation. Any views on health records consolidation? How do you see this changing? What should change or what needs to be changed to get better data insights from the data that we have? Anyone?
So I can take that because that's fairly in our wheelhouse. So there are two different things. One is getting records, right? Getting records is becoming easier and easier and is becoming a commodity. That's not to say it's easy. That's not to say it's not frustrating if you're a patient and you're trying to get your records. It absolutely is. But if you're talking about on sort of a broad system basis, how easy is it to sort of consolidate records? It's getting much easier. Everybody talked about real world evidence a couple years ago. Real world evidence is becoming a commodity. That said, there is a depth of data that is really difficult to get, that is A, not a commodity, and that B, has to come from, a very long longitudinal view of patient records. So it sort of depends where you want to go with that question. But I would say if the overall thing is, how easy is it to get stuff and share it, and how easy is it going to be to buy individual pieces of data? Easier and easier and easier, becoming a commodity. But if the question is going down, hey, where is the real value, right? The real value is still in this, long tail, 10, 20% of records where you have some really interesting data. And so the game has shifted from a data aggregation play to a data interpretation play, right? Having the data is not that helpful anymore because anybody can, but understanding how to derive insights from it is really becoming where kind of the zeitgeist is from a investor perspective.
So I would note that I think that the center of mass of the valuable data, certainly the quantity of data, has shifted outside the medical industrial complex. So unless you are undergoing very sophisticated studies, like you're doing fMRI studies for something prior to epilepsy surgery, we're just mass amounts of data are being collected about you. Your phone knows more about your health and well-being, functional status, all kinds of things about you than we probably sits in your medical records. And if you're connected by HealthKit or something else, it all has access to all your health records anyway. And so if I were to say, where's the next battle for health data, it's the distributed Internet of Things, which is really the Internet of diagnostic things if we choose to make diagnoses from that data. And that's why, there are a lot of the big players that are in consumer electronics, et cetera, are focusing on health because that's where they know the valuable data is. The large players in healthcare records are trying to push out into that space too. They're just really bad at consumer software. And so people aren't really using those tools. It's been like an amazing to see how poorly, for all the resources that big EHR vendors have, that their lack of ability to go into mobile and even into cloud is just absolutely astounding. So I think that's a battle. If you're an entrepreneur in the audience, you're thinking of how can I win and get access to data? I would focus more at point of living and not at point of care. Because
so
I think
maybe
as the
that's
center of
also
math
the-
moves to point of living, you can suck from point of care. You can suck data in.
Well, maybe that's also the opportunity maybe for a place like India, as we were saying earlier, right? Because the infrastructure, like the EHR silos don't exist. I mean, it's all paper mostly. And so I think there are opportunities for startups to kind of work in that space in India. We have one company, For Base Care, that's doing that. They're an oncology company and they're doing sort of oncology tumor sequencing for cancer patients to try to figure out which drug they might respond to. But because there's no digital health records, they've also created an app that now patients are uploading their data and bringing that with them to the physicians, and the physicians are loving it because now they're able to see the digitized format of things. So maybe in India, that is like an opportunity, and maybe there'll be a cool way to sort of digitize that, make it more sort of consumer focused, patient focused, so that the patients can upload even additional information on their lifestyle, et cetera. So maybe that's an opportunity, I think. I mean, you see that in China with WeChat, right? How they kind of like overstepped credit cards in a way. So you kind of wonder, like, is that going to happen in India, maybe for health records, where they're going to be able to sort of overstep maybe the
and
more siloed approaches.
We've seen that in India. India has the ability of leapfrogging a technology, right? For the longest time, Indian households didn't even have a telephone, landline, right? And there was such a bottleneck there that when mobile came in, we just leapfrogged. We went directly mobile first, right? For many people, that was the first phone they had. And so the adoption became like 97% in the whole country versus the US, where still we don't have adoption. It's like in the 80s, somewhere 70s or 80s. So hopefully healthcare has the ability to leapfrog in India. And that would be great. So again, I think we are almost running out of time. So I wanted to have this last question with you, which is again a question that has been asked by one of the attendees. You know, business models are changing, things are changing in the healthcare world, and it's very dynamic. And many of the people who are innovating here are technologists first and healthcare experts second, right? What should the new entrepreneurs keep in mind as they're looking to the healthcare industry? Beside a generic recommendation, which is what the person says, how would you suggest that entrepreneurs, what should they manage that, and where should they be focusing on? I mean,
I can run into that. Yeah, I think the best way is mixed skills teams. In the first wave, I was seeing just mostly technologists. Now it's very common you have technologists paired with people who really understand healthcare, because there is nuance around regulation, money flows. So having that converged capability, I've seen as a better proxy of success.
anyone else?
I will say that don't try to solve what exists now, right? Or what problems are there. Think a little bit ahead, because if you're thinking of what problem you're trying to solve for today, there probably are already you said $10 billion has been gone into healthcare as well, so there may be a lot of startups. So think, a little bit more futuristic, even though it takes a little bit longer to get there, and go for larger problems rather than for small markets, even though they seems challenging. So, and then have a strong team around you.
I think Bill's heard me use this here before, but in much of the West, there are three major stakeholders: patients, payers, and providers. And if you're trying to, large incumbents can go after them simultaneously because they have a lot of cash to burn. If you're a small company, I suggest you figure out a way to just focus on one of them. Because if you're trying to build a product team, a customer success team, a marketing team, a sales team, et cetera, all for three entirely different markets in parallel, that's typically a recipe for failure. If you can cut out two and just focus on one, you have a greater chance of getting some traction early and not running out of money and running out of business.
Good point.
Yeah, the only other thing that I would add is, look, try a lot of different things. Don't get stuck in I have to sell the hospitals, and, hospitals are 9 to 12 month sales cycle, and it is what it is, and just sort of admit defeat and admit to, what had been done in the past. I think there's a lot of room to innovate around go-to-market in healthcare, whether in the US or whether globally. And so, do some experiments and find some cool new ways.
Great. We almost at the top of the hour for us, but I had two questions and it was just rapid fire answers. If you were an innovator, what would you, just one word answers, which area would you innovate in? Starting with Amanda.
Genomics.
Anya.
Me, bioeconomy.
And Alex.
Neurotech.
We have Bill.
Digital therapeutics.
And Mohit.
Tech-enabled delivery, more cost-effective outcomes.
Web.
Personalized medicine.
So wow, we have 6 investors all wanting to innovate in 6 different areas. So there is hope for all the startups because you can pick an area that is passionate to you and you can deliver there. And if you had the money and you had only one investment you could make in healthcare, where would you invest? Amanda?
Therapeutics.
Anya?
Probably therapeutics right now.
Bill?
Yeah, drug therapeutics is going to be exciting for a while. It's funny. I don't invest in that area.
Mohit?
Yeah, the general space of biomedicine. I think, as I said, unlimited budgets this decade coming up.
Wab?
Digital health.
And Alex? I think I didn't get Alex.
Well, longevity therapeutics.
Oh, looks like overwhelming therapeutics, but good to know from you. And thank you all for taking the time and being here and giving this amazing session. I hope the audience, you must have really enjoyed this session. And I know you want to interact with the speakers that we have, and the speakers have graciously offered to connect with you. So we will, if you're interested in connecting with them, write to Ty and they will make the connection possible. So thank you all, and thank you. And
thank you all.
These
Thank you,
investors.
Dipti.
Thank you. Thank you.
Thank you.